This is the introductory section on chronic pain. I've had a almost lifelong experience of chronic pain since about 1990. It took me a couple of years because I was such an aggressive A-type personality. It took me a couple of years to finally admit that the pain wasn't going away. I'm going to address some very important issues in this series of videos on chronic pain. This isn't really meant as a legal disclaimer, but I'm not a doctor, and every chronic pain patient is different. And I'm going to be telling you some quite specific approaches to chronic pain. They've worked for me, and I think they come out of my notion of a life of reason, that I've thought them through, and so they haven't just been emotional reactions or some emotional response. I've actually been through withdrawals probably at least eight times, so that I know a lot about that process. I know a lot about the pain scale and about what doctors expect, so I'm going to talk to you about that as well. But chronic pain patients need to be honest with themselves, and there are chronic pain patients who might be offended by this, because there are chronic pain patients, and I've met them, whose pain is more psychosomatic and than physical. And that psychosomatic can be a terrible thing. Psychosomatic pain can be a terrible thing because it can be intertied with the depression, which is, we'll talk on the other in another area of this blog. But I've met a lot of chronic pain patients, and I'm going to give you a radical example of the cheaters in the chronic pain industry, I guess. I was at a rehabilitation center in Texas, like a boot camp type thing, very demanding exercises and routines. And I went into the bathroom one day, and one of the pain patients, a young man who had a work injury, who hobbled along quite a bit didn't do very well on the exercises, but was kind of skippy and happy in the restroom and outside. I went to lunch with him once, and I was amazed at how well he adapted outside the physical therapy building. But we were in the restroom one time, and he offered to sell me some Vicodin. And that is a kind of phoniness, someone trying to milk the system. And now I don't know how many people, that's fairly radical, but I don't think it's that uncommon. So people who come here with chronic pain, I'm going to ask you to look closely at yourself and figure out what part of your pain is psychosomatic, what part of your pain is physical, and what part of your pain is not pain but is just drug seeking. Chronic pain patients who are on narcotics are addicted to narcotics. I'm addicted to narcotics. I'm physically addicted to narcotics. But I don't go to AA, and I'm not particularly tell people that I'm addicted, but it's true. If my pain pump stops working, I have a pain pump right here, which we'll show you in another video. If my pain pump stops working, I go into full-blown 5-year-old heroin everyday addict withdrawals. Can almost kill me. I mean, it's horrible what will happen. So why did I bring that up? Oh, because chronic pain people have to deal with narcotics. You have to be honest about it, but you also have to know if you're seeking and how much of it is for the narcotic. And I'll tell you right now, and I'll emphasize this later, that the high of the narcotic, if you're really in chronic pain, wears off fairly quickly. Within 6 months to a year, it's boring. If you have any kind of life at all, it's extremely tedious and boring, and you'll dread taking the pills. You won't look forward to it. It won't be any kind of escapism. It will be a ball and chain. So I hope we can get a lot done in this part of the chronic pain section of this blog. I'm going to be honest. I'm going to give you common sense, lived, reasonable advice, but it's not medical advice. So if you think some of my ideas are good, be sure and talk with your doctor first. If you know it's a fairly radical change for you, and I really hope we can help each other with the struggle that we have with chronic pain, and that'll be the introduction.